This is Inspirational Women, a weekly series shining the spotlight on female trailblazers making a true difference in our community. Once again, here is Kate Daniels.
I appreciate your being here for Inspirational Women as we share insights and stories about women and heart health. National Wear Red Day is Friday, February 7th, a day we wear red to raise awareness of cardiovascular disease, the number one killer of women. My guests are both Go Red for Women ambassadors. Cynthia Granada is a woman who suffered a stroke and found an important place for support and to volunteer with the American Heart Association. Dr. Ruchi Kapoor is a cardiologist with UW Medicine and is a board member for the American Heart Association in the Puget Sound. Cynthia Granada and Dr. Ruchi Kapoor, good morning. I'm so grateful you're both here with us this morning.
Thank you.
Good morning.
Good morning.
Happy to be here this morning.
And Cynthia, yes, I think I doubly appreciate you making that comment about being happy to be here this morning because you're the one here kind of like, shall we call it like a hot seat? But no, you're our guest who's dealt with a stroke and not that long ago. And so in saying you're happy to be here, it makes me think, surviving something like that really makes you appreciate every day of life.
It does.
Yeah.
I feel now I don't question things anymore. If there's something that I want to do, I will absolutely do it. There's no vacillating between yes or no or could I, should I? No, I'm doing it. If I want to do it, it's done.
What it says to me is that's the way we ought to be thinking about our life rather than postponing, putting things off, wondering like, oh, should I? But if you feel that, it's just unfortunate we have to maybe go through a life-threatening situation to bring us to that place.
Yes, it was a turning point in my life. There's definitely a before and after. But yeah, I'm very happy to be here. And actually, my birthday is tomorrow, so it's like a triple.
Happy birthday.
Oh, yes, happy birthday. It makes it even, that much more meaningful, doesn't it?
Yes.
Absolutely. And Dr. Kapoor, your thoughts then as a cardiologist, you're encountering probably many people who are at various stages of maybe being in poor health or having gone through heart attack or a stroke. Do you get that kind of sense from them?
Absolutely. And I wish it wouldn't take a sort of a major life-changing event like a heart attack or a stroke. But it's hard for people to, I think, conceptualize that it's something that could happen to them, especially women, because everything that you see on TV and movies is portrayed as happening to men. So in particular, when a cardiac arrest or something major like that happens to a woman, it's incredibly sort of like, how could this happen to me? It doesn't happen to women, but it absolutely does. And I wish it wouldn't take that. And so a lot of my conversations in my clinic about preventative cardiology are about, gosh, I hope you never get to experience it. But if you do, it can be a devastating life experience. And here's how we can do things to prevent it. Nothing in life is 100%, but we can set goalposts for ourselves on how to improve not just a quantity of life that we have, but quality of life. And so we can live it to our fullest and not vacillate and just say yes to everything that we want to.
To make it the best. Yes.
Exactly. Yeah.
And Cynthia, for you, that was something that you were aware of yourself, probably through media information, that when you were suffering this stroke, you really thought you were having a heart attack.
I did. I thought I was having a heart attack because it started in my left arm. And I just knew, I shared this with you before, but really, I just knew there was something wrong. And I could feel it. And I knew it wasn't right. And I immediately just called my husband and told him, we need to take me to the emergency room right now. Let's go.
Part of that's striking me as women's intuition, or just really knowing yourself and being firm about what you know.
Yes. And I think that oftentimes we as women are dismissed so much in a lot of the things that we share with people that we kind of put ourselves in a box and are like, no, it'll be fine, or I'm okay, or it's nothing, or whatever. But you cannot let anyone take away your agency, and you know your body better than anyone else. You've had it your whole life, and when something is wrong, you feel it, you know it, and you need to act on it. Don't worry about feeling stupid because, what's the alternative?
Right. Yes.
Yeah.
Yeah. Not a good alternative. So trust yourself. And that's pretty much to what you're saying, Dr. Kapoor, to your patients.
Absolutely. I've seen more than one person with the same exact story is, I had this chest pain a couple of days ago, but I thought it was just acid reflux. And then a day or two later, they're like, and then it got more intense. And then I, had my husband take me to the ER, but it wasn't, or my partner or my family member take me to the ER, but then it wasn't, the blood test didn't quite show anything was wrong at that moment, or it wasn't slam dunk heart attack or stroke. And so they were like, it's just in your head and go away. And I think it's up to us, the healthcare system and doctors, to recognize that women don't always present the same way as men do with heart attack or stroke. And so not being very quickly dismissive of the symptoms, but also recognizing that a lot of times I think women tend to put themselves second and their symptoms second. And so giving some agency to our female patients that it is okay to speak up about not feeling good.
And I feel that this is a prime time of year to be doing some of this educational work because it's Go Red for Women, which is, I think, here as we sit in our red and feeling empowered by red, this is a really good time to heighten that awareness and encourage women, correct?
Absolutely.
Absolutely. I couldn't agree more.
And Cynthia, you're an ambassador for Go Red. So what does that entail? What's the energy behind that?
Oh, there's so much behind it. I want to be able to talk to other women about my experience, to let them know that they aren't alone, because when I attended that very first event I went to in 2023, I actually felt seen, and I could identify with what these women were talking about, and listening to their experience and having so many similarities. It was like, wow, because I literally couldn't speak to anyone because no one had gone through what I had been through. So to be in, oh my gosh, I'm going to get.
It's okay. That's natural.
It was very emotional because it was so fresh. So just knowing that there was an organization you could go to, or other women out there experiencing something similar, it felt good.
That is really incredibly powerful. Really.
Well, not also for them to open up and share their story and not being afraid to go out there and be vulnerable, which I think is the hardest part. Especially for someone like myself who's like a super control freak. I don't want to let anybody inside. But that just is like, well, I should give back and I should do the same thing because I want someone to feel that feeling of being seen and understood.
Yes. Honestly, don't you think, Dr. Kapoor,
that's such a
volumes, speaks
Yeah.
volumes?
Yeah. And I really do appreciate you coming forth and sharing, because somebody, even if it's just one person hearing your message, hearing your story, and will be the spark that creates a movement for that one person who'll then tell somebody else, like, hey, guess what? Women can also have heart attack and strokes at a young age, and it's not just a older person's disease or older man's disease. And I think carrying that message forth is, even if one person hears it, that makes a big difference. And the other thing I wanted to say is, as I'm hearing you tell your story, is I don't see this side of patients, right? Because usually when I'm working in the hospital, it's let's just get things done. Let's get the the clot taken care of, or let's get the medications that we need to get started. Let's get the interventions that we need. Let's get them out of the hospital, get to rehab. It's every day is a go, go, go. How can we move the needle of care forward? And then afterwards, when I see them in clinic, it's usually a few months past and things are stable, just making sure that their life goes on, as it can. And this sort of emotional toll that takes place, I don't see it as a physician. I don't recognize it. And I don't know that I could, because it's not something I've experienced. I see it a lot, but it's not something I've experienced myself. So to me, it's incredible that American Heart Association provides this sort of safe community for people who've gone through this experience to meet with other people and are able to identify and not feel isolated, like they're the only person in the world that this has happened to. And I see Cynthia nodding her head very vigorously.
That isolation, that I actually have talked to other people about it. It's very isolating when you can't talk about that experience with anyone. And while they can empathize, they don't understand that lived experience. And those are two completely different things. And not to say that I'm ungrateful for any empathy that I receive, but it's not the same. I want to be able to discuss these emotions and the roller coaster and the up and down. And it really is like going through the stages of grief up until you get to acceptance.
Yeah.
From like A to Z, top to bottom. It's this, you're sad, you're angry, there's bargaining, like why me, or why did this happen? What did I do? There's just everything. You go through all of it. And you're also grieving the loss of the person that you were prior to this event, because you're not the same. You're never going to be the same.
That's so incredible to really hear that for me as a physician, because I don't see that. I don't hear it, and I'm hearing it right now, and it takes me actually being outside of my workplace to really receive this message from people who've gone through this experience. So I have to say that I think it's a shout out to all the women who've gone through this and are willing to spread the message and are willing to support each other, and to American Heart Association for allowing a place for them to come together to do that.
Yes, really. And for someone who's not experienced it, but who gets to listen to these stories, which I deeply appreciate, I learn. But you've like pulled back a curtain, Cynthia, to let us see that there is really this whole other area that we haven't acknowledged, because you're experiencing it and you're bringing it to us so that we can learn from this, and it helps us to grow, and to really, for other women who may have already experienced this, or when it may happen, because the numbers are there, the statistics are pretty big, that it could happen to us as women. It's the major health issue that does kill women. True?
100% true.
Right?
Yeah. It's every year the statistics are coming through and showing that cardiovascular disease, heart attacks and strokes, and other, not just heart attacks, but other forms of cardiac disease are the number one killer of women, more than all the other cancers combined. And it's just not a well-known or well-acknowledged fact. And sort of, I feel like, that we could do a lot more in telling people about this and raising awareness about this and helping them take care of themselves and paying attention to the numbers so that we can change that statistics. It would bring me no greater joy than the day that I'm out of a job because there are no more heart attacks or strokes, or at least much less of them than what is happening right now.
Right. So Go Red for Women is coming up on Friday. And I think I'm appreciating it even more so in this moment after hearing you share more of your experience, Cynthia, how wearing red, if enough of us are wearing red, maybe it raises the question to talk about it, to heighten the awareness, right?
Yes, I would wear red every day if it made people talk about it. I think it's so important. It's not just for women, too. It's for everyone to understand the effect of this disease. And I think the organization is doing such an incredible job of raising awareness. and helping us spread the word out there by doing things like this. I feel lucky to be able to tell my story and to let other women know they're not alone, and to let them know where they can find the resources so that they can prevent something like this from happening, or so that they can recognize the symptoms, the warning signs.
Well, let's do that right now. Let's take that opportunity to talk about the warning signs. I mean, you were certainly aware. You knew that you were feeling something in your arm, which is certainly a sign of a possible heart attack, right?
Yes, absolutely. Women still get chest pain more often than any other symptom, but it's the big major symptom for men. For women, they get a lot of other things also. So it might not be pain per se, but it might just be a heaviness or squeezing or just a discomfort sensation that's really hard to describe. And they tell me a lot of times it's not pain. I was like, but it's okay. It doesn't have to be pain, but any kind of a chest discomfort or jaw or left arm pain or discomfort, but also other things like feeling really short of breath and getting winded with just minimal activity, like going to the bathroom. And you're like, gosh, I can't do that anymore. And it just started suddenly an hour ago. And sweating and getting nauseous, all of those can be signs of a heart attack. Usually it's not just one, right? So if you're going to have a nausea, that's it. And that's usually not enough of a sign of a heart attack. But if you start getting combination of any of these symptoms, and especially if you have any of the risk factors that we think about with heart disease, like diabetes or prior history of stroke or heart disease, blood pressure, high cholesterol, family history of early heart disease, anything like that that's sort of increasing your personal risk of heart attack, and you start getting any of these symptoms, that's a reason to go to the hospital or call 911.
Right. So a little tidbit about that. Certainly when there's all of those factors, the history, and if we have some of the predispositions, high blood pressure, certainly if we carry too much weight, and as we age. So I mentioned these to my primary care doctor, and she said, well, maybe we should do a stress test. Mm-hmm. So just recently I did have a stress test done, which I think it's good to have that.
Stress tests are interesting because we used to use them historically as a screening tool. And we find that they're not actually that helpful anymore, unless somebody's having symptoms that really concern us that may suggest a sort of gradual narrowing of a heart artery. Then very reasonable to do a stress test. And I tell people, if we can have you go on a treadmill and exercise for us, and, we find out how long you can exercise on the protocols that we use, which is very helpful. Because we can say, okay, if you're only able to do a couple of minutes of exercise on this protocol, that's not as good a prognosis for the heart as if you can do 10 minutes. And the test gets harder. So 10 minutes is a long time for a treadmill test. But I think just sort of being able to look at how much you can exercise on this stress test. But a great substitute for that is how much exercise you're doing outside of the clinic, right? So if somebody's telling me, I climbed Mount Si last weekend and did fine, but then I get these other random chest pains. I was like, oh, you did a stress test on yourself last weekend, okay? And if you're telling me you didn't get symptoms, my suspicion that you have underlying heart disease is very, very low. So stress tests have definitely a time and a place, and they're very appropriate to do. But using them as a screening tool for heart disease, we just don't find that to be very effective. There's risk calculators instead that we use more often now. And risk calculators take into account all the things that we just talked about. So whether you have diabetes, what your blood pressure is, what your cholesterol numbers are. They don't always take into account family history, or there's some other sort of risk enhancers. For example, if you're a woman who had radiation for breast cancer many years ago, modern day radiation is not as much of an issue, but that can increase the risk of early heart disease. or certainly, people who had Hodgkin's lymphoma as a child and got mantle radiation, that can lead to early heart disease. I had a young woman who had needed bypass surgery in her 30s because of that. So I think there's risk calculators that we use to estimate the risk of heart disease in the next 10 years. Those risk calculators are not perfect, so we do have to look at other things. For women specifically, one other thing I look at is whether during pregnancy they had preeclampsia or gestational diabetes, high sugars during pregnancy, and that can be a risk factor. Also, early menopause, for example. So there's a lot of other factors that go into predicting risk. I have to say that's a holy grail of medicine in general, is if we can predict Cynthia in the next 10 years is going to have a stroke, then great, we would get you on the medications right away. But we haven't perfected that. So we have our tools that we look at, and some tools are better than others, but that's still evolving as a science.
Saying that there's a medicine, something you can use, though, with stroke. And I know that that's part of what happened for you, certainly getting to the hospital very quickly. And your husband took you to the hospital when you were feeling that arm numbness, right?
Yes, correct. I was fortunate to be able to go to a hospital that is trained in stroke care. So they knew exactly what to do. They saw me right away. But everything happened so quickly, and you have a very short time frame to take the medication, and it is supposed to help reverse whatever symptoms you may be having at the time within hours. And I am lucky enough that I had access, that I got there in time, and I was able to receive it. I don't know what my life would look like had I not received it. At that point, I couldn't move my leg or my arm. So would I ever get the use of my left leg back? I don't know. I really don't.
And those are there are four things that we need to remember in terms of a stroke. Actually, did you know those at the time?
The be fast?
Yes.
No, I did not.
No.
No, absolutely not. But that last one, time,
yes,
that is like ingrained in me. Okay, time.
Time is...
Absolutely.
Well, let's go through the four things.
So we have the FAST acronym: face drooping, arm weakness, slurred speech, and time to call 911.
So critical. And so, yes, you acted really quickly. Your husband was ready to take you right there. And you were close enough that you didn't think that you needed to call 911?
No, I didn't think to call 911. I just thought it would be faster if he took me.
Yes. Okay. And I think perhaps that's the case. And you and I were talking about this earlier and thinking about how where we live here in the greater Seattle area, we're really fortunate in terms of having hospitals that will respond to this instantly, right?
Mm-hmm.
Yes.
Yes. If I were living in some rural area and didn't have access to a hospital like that, I don't know that it definitely would not have the same outcome. You wouldn't be able to get the treatment in time. You wouldn't be able to get to a hospital that would be able to serve you in time.
Yes. So we are fortunate. So to be aware of that and really embrace the fact that we have it and respond to it. And then with the American Heart Association, with heightening awareness, we make people aware so that outlying areas, they have that information, how to get to somewhere quickly, maybe to get those nearby clinics, right?
Yeah. So I spend time at Harborview Medical Center, for example. That's one of our stroke centers. And so we airlift people in from rural communities if they're having a major heart attack or stroke to get them the care as quickly as we can. It's certainly not as quick as being able to go down the street and getting the medication right away, but it's still quick. And the key here is time, right? Time is brain, time is heart muscle. The sooner we can reverse the blockage and restore blood flow to the brain, to the heart muscle in case of a heart attack, the same rules apply. Sometimes we can't do the procedures that we need to, but the medications can be available at local area hospitals.
And there's a window. I
Yeah.
don't know why 4 hours sticks in my head.
Yeah.
Is it still
For a stroke.
for a stroke? Yes.
Yeah. For a heart attack, there is also a time window. It's what we call door to balloon time, from the time that somebody hits the emergency room door and we find out that they have a ongoing heart attack, a major one, then getting that blood vessel opened up, that's our door to balloon time, and that's 90 minutes. So we try to move fast if we can. Fast in so many different ways.
Yes.
Be fast.
Yes.
It's also embedded in my brain.
Yes, which is good.
Yeah.
It's good that it's embedded, along with the fact that you are so passionate now to really share your experience. Some people, I think, are embarrassed and they just want to hide away. But you are articulate about this and passionate. So you're so important in this whole component of really heightening awareness, Cynthia. So I'm really grateful, that you are like this.
Well, I'm grateful for the event because I didn't want to, because of the fact that I had to be vulnerable and open myself up. But then again, after seeing these women, thinking about it, watching all of these women share their stories and how they've come out of it on the other side and how they're helping and serving their community to spread the word, it's inspiring. Mm-hmm. And it's like, well, then let me stop being a baby and just and let me get on board too.
Yeah.
She's not being a baby at all, is she?
No.
Strong woman right here in red. Power red.
Yeah. Oh my gosh. Your story is so incredible, and thank you for sharing it. You're not being a baby at all.
No. And really, the transformation has been, I would say, very quick, because the stroke was in September
2022.
Okay. And then it was how much later you went to the event?
So about 6 months later.
Yeah.
Wow.
So it was, like I said, it was very
Really
fresh.
fast.
Really fresh.
And here we are now. You're Go Red for Women ambassador. And on Friday, February 7th, we have this opportunity. Wear red. And if you're not sure why you're wearing red, well, do it and then find out. So we all just are a sea of red here in the city. And then, of course, at another point, we'll be having an opportunity to talk about there being, now I don't think it's a luncheon, it's a dinner that we have in March. That will be, again, a major event to hear from persons like yourself who have gone through the experience to promote education, awareness, and self-care and trusting ourselves, right?
Yes. I actually have a friend who also suffered a stroke recently. And so her and I have talked a lot because she didn't have anyone to talk to. So sharing our experiences has been, I think, therapeutic for both.
What a mission. I mean, that one-on-one, yes, the events are great. It can be the kind of that inspiration. But I think walking hand in hand, shoulder to shoulder, heart to heart, really is so critical. And it's obviously a different kind of empathy, since you've both experienced it, a different level of communication. But being vulnerable, because there are people who will just, like you said, you want to hide away, but there's just such an empowerment, isn't there, in being receptive and sharing.
Yes.
I would say that the dinner is raise awareness and the Wear Red is raising awareness. But a big part of it for me is also an acknowledgement of everything that women have gone through who've suffered a stroke or a heart attack, and just being like, yes, you did it. You went through this and you've come out the other end, and just an acknowledgement and a hats off to all the women, the ones who are sharing their stories, but even the ones who are not, who are still maybe in an isolated space and don't have anybody to empathize with, and just an acknowledgement. We hear you, we see you, even if you're not here with us right now.
There is a website, wearredday.org.
Mm-hmm.
Lots of information there, again, to underscore parts of what we discussed this morning, to get more information, to think about the risk signs, what to do, and simply who to reach out to. As Cynthia was saying, going to an event really is eye-opening and builds awareness. So really critical.
Absolutely.
But this kind of time is also so wonderful and critical to really bring forth the power of story, of sharing and the power of women to really be supporters and encouragers of each other.
Absolutely.
And that's what you both are.
Oh, thank you.
You're so welcome. And thank you for being here today. I've really so appreciated meeting you both and having you share all that you have to share.
Thank you for having us and help spreading the word.
Yes. Thank you so much, Kate, for being a huge supporter and helping us raise the awareness and advance our mission.
This wraps up the hour of important stories for our health and awareness. Please check our station's website for the podcasts for more information about these guests, and please share the stories with your friends. I'm Kate Daniels. Thank you for listening.
Thank you for listening to Inspirational Women. Tune in every Sunday morning at this time to hear about those truly empowering the Northwest community, all for the greater good. Sunday Morning Magazine and Inspirational Women are a public service of Hubbard Radio Seattle.